The Health Secretary laying out the government's measures to tackle the Omicron variant, saying it's proportionate. One of the most contentious rules is introducing COVID passes in England. The Health Secretary insisting it's not actually a vaccine passport because it has a lateral flow test option.
This is not a vaccine passport. I mean, the right honourable gentleman should know that a vaccine, if he wants to see a vaccine passport, he will know that in Scotland, or he can go to France or some other countries.
Many Conservative MPs are against the passes as they've often been extended in other countries and there's little evidence they help curb COVID cases.
For ourselves, we decide.
A hit from Sir Desmond Swayne MP describing a culture of fear.
Notwithstanding the carnage on our roads, certainly killing more people than COVID at the moment, some of us still decide to drive. It's a matter of opinion. So it comes down to letting loose the dogs of war. Get the fear factor into it. Get the members of the officials, the members of SAGE, the members of Independent SAGE, of SPI-M. All those, of course, speaking in their own private capacity. Get them out there twisting the fear lever.
Concerns also that mandatory jabs for healthcare workers would mean care staff will leave. On mandatory vaccinations for everyone, confirmation from both sides that they won't back that idea. That's following Boris Johnson's recent hint.
Although we've seen plans for universal mandatory vaccination in some countries in Europe, I will never support them in this country.
I want to make it crystal clear that we do not support mandatory vaccinations in general, and I welcome what the Secretary of State has said this afternoon. Not the first time he's had to clean up the Prime Minister's mess.
Labour says they'll support the government's measures, including mandatory vaccination for health workers. And it's still unclear whether the one person who died with Omicron died because of the disease. But Javid says 80% of those in hospitals with COVID are there because of COVID symptoms.
Approximately in English hospitals, about 6,000 people with COVID, as they're positive COVID cases. Of those. Around, as I've shared this information with the House before, because I was determined to get this information when I first became Health Secretary, of those, approximately 80% are there because of the symptoms they have from COVID, and around the rest, about 1/5, are there because for other reasons, and they also, of course, have been tested for COVID and they happen to have COVID.
Many in the Conservative Party say they feel some measures go against the party's values of personal choice. Jane Worrell, NTD News, London.